Can I ask you a question? Just from me, as someone who hasn't gone through childbirth, I'm really interested in if you could kind of give us an idea of what the difference will be. What an experience, one with Kemi and one, or someone, of like you, who you are, and then just a normal one where you don't have that support and you're in the hospital alone. Just so we have like a clear idea of what's happening.
I think if a woman's left alone, she could have an experience similar to the one that she would have with me there. And I know it sounds awful, but if I'm there, what I'm trying to facilitate is her feeling safe, but then going into this bubble of hormones that gets the job done really efficiently. So I want my presence for her to feel safe in it, but I don't want her to think that I have to be doing anything, because I don't. Because it's like I was teaching with Katharine Graves at the weekend, parents, and one of them is a farmer, and he'd missed the first day of teaching but was there for the second day because he had other commitments, and he was there for the second day, and he came up to me afterwards and he said, and he basically taught what he didn't have on the first day. He kind of, because there was a group of us by then, and he said, "Yeah, I'm a farmer, and I would never dream of entering a stall where one of the animals was giving birth. I wouldn't dream of making a noise. I wouldn't dream of disturbing the process or trying to help unless I need to help." He said, "Because I know that by me stepping into the stall or changing the environment for that animal, there's a chance that we could lose the young, because it won't unfold in the same way." And he's basically teaching. Yeah. He was basically saying what I teach, or what we teach on day one. Yeah. I felt a bit emotional when he was talking about it again. I'm quite emotional about what I do, because I know so many women aren't afforded that respect, but a farm animal is. So, a woman would be expected to change state, to have strangers enter her environment, to be asked to open her knees and, open her legs for a stranger. And so the thing about that, again, is that I don't actually do vaginal examinations unless there's a clinical reason to do so. So if she's not following a usual path, then it would be helpful for me to find out exactly what state her cervix is in, which way the baby's looking, etc. But it's still an offer. She doesn't have to accept it, because that's actually her body. She has agency. But what happens to a woman with somebody who doesn't practice in that way is that she's in a vulnerable state, and then she's frightened into opening her legs. So it's not much different from being raped. So, we call it obstetric violence. Some people, if you mention that term, people get very, no, but we have to do these things to preserve the safety of the woman and the child. No, you don't. You don't have to violate a woman to keep her and the baby safe. I've never had to, and I guess certain situations, if she's in a state of collapse, then maybe to save her and the baby, and she's in a state of collapse, you have to do things without asking. But I've not seen a woman in that state of collapse, and I know there are people that do, and so I understand that they may have a skew towards behaving like that. But I would, all of us would appreciate if they could tell the difference between a woman who's in collapse and unresponsive, and what you might have to do, and what is being done to women several times a day in our maternity services at the moment.
I think that. I think what I think is great about your role is that the information that you provide is so important, which I know is why you have moved from being a midwife.
That's right.
To being an educator.
That's right.
Because
I'm occasionally a midwife, but my main role's an educator.
Yeah, so by giving people information, so like the norm, thinking it's normal to have someone put their hand inside you and root around. Or as I was explaining to Christina earlier about induction. And so you know, like all these things considered normal because society thinks it's normal or doesn't question it or doesn't have the information. And the fact that if you actually talk about it and analyse it, why is that normal to have someone stick their hand in you?
Yeah.
And you think, as a woman, I should just, you know...
submit.
I should just shut up and this is, you know, they know what they're doing.
And be grateful. Yeah, they know what they're doing. Yeah. Sarah, you mentioned induction, which is a biggie because it's an intervention.
Yeah.
And membrane sweeps, you know, I harp on about it, but membrane sweeps are an induction. They are an intervention. So,
can you tell us what a membrane sweep is?
So a membrane sweep is probably, I always kind of say, about 90% of women have had one because it just seems that everyone's having one. And I don't do them at all.
So like, how would you lead into someone having an induction? Yeah. What is the policy for when a woman gets to...
Yeah. So the membrane sweep, before I forget, is part of the induction process.
Right.
And because it's not a pharmaceutical or an instrument, a lot of people will say, no, it's not. It's just a sweep. But it's trying to make birth happen before the spontaneous event of the interplay between mother's hormones and baby's hormones, or baby's release of protein and mother's hormones responding. So anything is induction. So going to reflexology to make the baby come is induction. You know, it's all induction. It's trying to make something happen when your body's not quite ready yet. Otherwise, you'd be in labour. So the sweep involves a woman lying on her back. The midwife or the obstetrician will have a glove and maybe some lubricant and will then try and access the cervix. So enter the vagina, and the cervix is at the top of the vagina, trying to get a finger or two in there to inside of the cervix to separate the amniotic sac around the baby from the cervical tissue of the woman. So when they do a sweeping action, like in a circle, they release a hormone called prostaglandin that is impregnated in the cervical tissue. And that prostaglandin ripens the cervix. So basically, someone with a finger is doing what the baby's head would do, because the baby just swishing around, a well-engaged baby swishing around on the cervix will do the same thing. It will release prostaglandin, but they're trying to make it happen soon. Yeah, when it's ready. Right. So we'll go in there and fidget around, but it's a wonderful saying by the amazing, great Mary Cronk, who's one of our matriarchs who sadly passed away a few months ago. And she was always fighting for women and advocating for women. So she said, induction, she said, she'd start and say, spontaneous labour is like a finely trained, highly skilled, synchronised swimming team. And induction is like shoving one of them in and expecting the rest to catch up.
Yeah. Right.
Yeah, you're never going to get the same result, because spontaneous labour is an orchestra. It's a dance. It's an amazing interplay between child who's sent that signal of readiness into mum's bloodstream and mother responding. And when we do things like poke around with a cervix, or stick a balloon in there, Cook's balloon, just stretch it open, or let's just get some PG3, so let's get some prostaglandin and just stick it up there and see what it does. And then, okay, let's break the waters and let's see what that does.
I'm going to bomb into the swimming pool and just see if they can do their routine around me.
Exactly. Just like, chuck it all in. Oh, yeah, okay, let's just break the waters and see what's that. Oh, okay, let's go and get some synthetic oxytocin. Let's bang that into her bloodstream and see what happens. Oh no, the wheels have come off. I say, okay, we'll do a C-section. And that's what's happening to women all the time in this country.